Gallows humor. I don't even know if I should bring this up, but it's going to happen to you. And I think there's an appropriate part for graveyard humor, gallows. There's things that, there's things that you will make fun of that nobody else will understand because of the context of the work that you're doing. And it's common. I mean, we trade in it all the time. And you don't want to cross the line because there's places then where that is inappropriate. But I think this is okay. I can't afford health insurance, but I found a vet who saved me 70% of my vasectomy. Now, if you don't have a cat or dog, you don't know what that hood is. Just ask somebody else a little later. That's kind of gallows humor. I didn't know they had surgical residencies in 4-year-olds. My roommate in college came to visit us in Chicago, and the University of Illinois Medical School is in Chicago there, and so I took him to the cadaver lab, and I knew he's squeamish, so I knew it was going to bother him when we first went in. Well, I went in there, I was dissecting away for a couple hours, and he was kind of sitting over there looking in the other direction. We got home, and guess what we had for dinner? We had meat fondue. It's not cheese fondue with little bread, you put in the cheese. It's little strips of meat that you put in the oil, And so we're sitting there, and I'm thinking, I says, oh, this reminds me of the cadaver lab. And Greg didn't eat a bite. I knew that was going to shut him down. He never had a bite of that meal. But it's just, I'm playing games. It's just games. I'm not being unkind to the cadaver. And by the way, I think that we should show dignity to the cadaver. I wasn't doing that. It's a little bit of this gallows humor or graveyard humor that you'll trade in a lot because it's something that kind of keeps you going and keeps it light. Just be sure the wrong people don't hear it and that you keep it at an appropriate level. Choose the things that invigorate you. I have a friend who's a brilliant philosopher, but he's had some rough blows in life, and he and his wife are just delightful people. And right now they watch movies, but they only watch things like Ever After or Cinderella or things with wonderful endings to them. And so if that works for you, buy one of those and watch it 3 times a week. If that works for you. A movie often will work for me. I watch Gladiator. Okay, I watch Gladiator. You know why? It has the highest level of dialogue of any movie I have ever seen since A Man for All Seasons, Sir Thomas More. It's a very, very high level of dialogue, and that works for me. You might not like that, but choose something, a book. How many people are reading a novel? Anybody reading a novel now? The reason I don't pick up novels is because I will get lost in that. And at the end of that, then I feel I'm in a different place. Things that inspire you. What really does lift you up. Biography sometimes can do that. Stay positive. Try to hang on to the positive things. Try to look at things from a positive light. I don't trade in optimism versus pessimism. As a futurist, you have to be a realist. You have to be a realist. But optimism pays dividends. There's no question about it. Optimism, people are happier, they live longer, they have less disease. They might be completely unrealistic in their worldview or their ideas, but try to stay positive. Feel privileged rather than resentful. Okay, there's a privilege, and then there is a tough part of what you're going to be going through. You are a privileged few people. You are. No matter what anybody says, no matter what you think down the road further on, you are a privileged. It's a great honor to be able to be where you're at and doing the things. So you can lapse into resentment, but what I'm saying, guard against that, because going down that road leads to further bad things. Be high-minded and generous. And then if you're high-minded, if you have noble feelings and you hold on to the noble intentions that you had at the beginning of this road, and you have a generous spirit, then you don't have to feel inordinate levels of guilt. Yeah, so you messed up. You did the best you could. You're not a jerk. You're an intelligent person. You're working hard. Your spirit is good. Your motives are pure before God and before humanity. Be careful of guilt. We're all going to make mistakes. Guilt is not a sustainable motivation. I just left guilt on the side of the road a very long time ago. It's a painful, difficult process that does not pay you back. Of course, we're all guilty, but that's been taken care of by Jesus. And I'm just saying, leave that at the side of the road. And don't perseverate on things. What works to get your mind out of that track? Because once you get going in that track and you just remember that one thing that the patient said to you or one thing that a teacher said to you and you just keep playing that track, you got to find a way to get I'm talking about records, aren't I? I got to get into the real world. I mean, I don't know what iPods do with preservation, but you got to get your brain out of that rhythm that it's in. Finds ways to decompress. I have some friends, they know how to decompress. They know how to rest and get the stress out, the intensity out. The intensity is the psychic vigilance and the muscle tone that we have. We all have a certain amount of muscle tone, a certain amount of psychic vigilance all the time. If you didn't have muscle tone, you'd be a puddle on the floor. We call the neurologist. I mean, but under the conditions of modernity, the psychic vigilance and the muscle tone is always increasing, and so the intensity is always increasing. And you got to find ways to let that come down. But then, after you're down, then you got to re-energize again. And so I rest. I mean, I rest and I sleep and I cycle back quickly, and then I watch Gladiator. I mean, I don't watch it all the time, but a few times I have. Hold on to your initial and noblest intentions. I mean, what drove you into this to begin with? Think of the highest, loftiest motives that you have, or the most wonderful patient encounters that you might ever have. If you're going into dentistry, think about that story I talked about, that guy who fixed all the uppers. I mean, that is just awesome. I could keep going for 10 years just thinking about that. And the wonderful, in terms of medicine, the wonderful patient encounters and patients that have been so grateful. You can't sit there and think about the other group of people, because that's just going to push you off a cliff. Think about the ones that God would have you. Relationships, take care to nourish them. You know, you can't have the same wide selection because there just isn't going to be the time or energy. But the ones that are key to you, you have to be sure to plow those gardens, those fields deeply, to nourish that garden, to take care of that. Communication is going to be really important. Whether you're married and have a spouse, whether we're just talking about friends, communication is important, but try to be gentle. You know, there's an international proverb that says words are like bullets. Once they're gone, you can't get them back again. They do the damage, then you have to try. So sometimes you get irritable and you're tired and you're not guarding your words, and you send out those bullets and boom, I mean, the whole, you know, you got just a war zone in front of you. So be gentle. And please don't be high maintenance. I mean, if you're the student, or if you're a spouse, I mean, that just, there's not enough energy in the system for high maintenance people. And you know, I'm gonna say that and drop it, but if you understand what I'm saying, it takes too much time, it takes too much energy, it's wearing. Just try to be gentle and be gracious and be giving to the other person and have that be reciprocated, and decrease expectations. Again, both the student and spouses and other people that are around. You can't be all things to all people all the time by yourself. You can't make every appointment or visit or family reunion. You can't sing lead in My Fair Lady in community theater. I mean, you just can't do all of this. I had a resident come to me in the middle of the third year, and he says, Dick, I finally figured out how to survive residency. I said, how's that, Ken? He said, well, at the beginning of every day, I just assumed this is going to be the worst day of my entire life. At the end of the day, when it was only half that bad, I figure I won. There's some real wisdom. He had a twinkle in his eye. He was just a kidder anyway. There's some real wisdom to that. You see, because your experience is going to depend on the expectations you had when you came into it. And if you had expectations up here and it comes in here, you're going to be crushed. Even if this was realistic and this where you were was completely unrealistic and unattainable and unsustainable. So if you lower your, I always tell my kids, have high hopes and low expectations. Give your expectations to God. So you will save yourself tons of grief if you just lower your expectations a little bit and don't expect everybody to be perfect all the time. And narrow and limit your focus outside of medicine. I think we've already talked a little bit about that. In terms of relationships with the patients, you know, sometimes the system starts to cloud our judgment. It gets us running and we're stressed out and we just feel like there isn't that time that you really hope to have for the patient encounter. And that's true. I mean, in real life, that's true, and it's kind of tragic. I mean, there's been a breakdown in that doctor-patient relationship in so many ways. But I used to tell the residents, you close the door, you sit down, it's you and the patient. And people, no, there's a lawyer there too. No, there's a computer there too. No, there's the medical record. Yeah, I hear that. I know that. It's you and the patient. You and the patient are in the room, and yes, you don't have a lot of time. You and the patient are in the room. You look them in the eye. If you have permission to do it, you put a hand on the shoulder, hand on the knee, hand on the arm. I would always start with that. Now, I mean, a lot of times you're not supposed to touch people or something. Sue me, fine, I don't care. I mean, the therapeutic effort starts the first time you touch them. You put a hand on their back or something like that. It's a powerful thing, not inappropriate. I have never touched anybody in inappropriate ways, but I touch my patients. And you look them in the eye and you give them an opportunity to look you in the eye. And it started, healing has started already. And so you carry their burden. You can't be super doctor with every patient. But for these few minutes, you can carry their burden. And then if you have to leave, in a shortened period of time, that is tragic. I mean, my heart felt that with almost every patient that I had to leave before I was really ready to leave. But nevertheless, when you close the door, it's you and the patient. Get on the train and enjoy the ride. I always have viewed my life as a 500-car train. I live in a caboose. God drives. I have no idea where this train is going, but it sure has been an interesting ride. So I'm always looking around the corner and seeing what comes up next. You don't know what next year, 5 years, or 10 years, or 30 years from now is going to look like. But if God is driving the train, just get on and enjoy the ride. There'll be some bumps. There'll be some difficult times. There'll be some sleepless nights. There'll be some times where you feel like nobody understands, and where you're just weary, you're just exhausted. But you know what? Sleep it off. I mean, you will get better. And when you graduate and you have clinical competence and you go out there and you start seeing patients, or you start drilling teeth, or you start delivering babies, you'll be so glad for every brutalizing night that you spent, in the neonatal intensive care, or whatever it might be, because that system does work. And in the meantime, forgive us for doing this in this way. We need to humanize the system more. And we need to take seriously that whole thing about violating every rule of health in the name of teaching health and practicing health, because we're just not good role models for leading healthy lives.